Please welcome Rose Anderson, Meredith DeZutter, Stephanie Krieger, and Ellison Matthews.
The Mayo Clinic is an institution that has been providing high-quality health care for over a century and a half. In 2014, Mayo Clinic earned the #1 spot on the U.S. News and World Report Honor Roll. And in 2015, Mayo Clinic earned #1 in 8 specialties. But we still don't have it right. We are missing the point. Mayo Clinic is excelling based on the measures of a broken system. Healthcare has become a slave to trying to fix the default system through process improvement. We're missing an opportunity to understand people and allow that to drive the care that we deliver. But I don't mean to say that no one in the system is trying to make things better. People are working hard every day. And it's the incentives and constraints that are limiting our ability to deliver value. Every system is perfectly designed to get the results that it gets, and the US healthcare system is no exception. We know from our research at the Center for Innovation that people avoid healthcare because of cost and complexity. We see the system showing a remarkable arrogance and unwillingness to understand people as they are. Burnout has become an epidemic, and people feel abandoned in a system that denies them access while providing them no personal value. We need to stop trying to fix a broken system. We are missing the point. It's time to take the opportunity to understand the ever-changing and evolving needs of people and allow that to make the system stronger, rather than trying to shove the needs of people into the default system.
At the Mayo Clinic Center for Innovation, we know people. We have a wealth of knowledge and significant insight into what the needs are. Hold on. You guys are making me really nervous. However, even with that insight, we learn something new with every observation and each experiment.
Okay.
I'm really sorry.
This is actually an fMRI experiment. We're scanning your brain right now.
This is probably the worst moment of my life. So
No,
I hope my brain is my brain
great.
reflecting that properly?
We'll have the pictures. We'll have the images later.
Yes, I'm glad I could share this with everyone here.
Yeah.
Yes. So we know people, and with every experiment, every observation, we learn something new. The foundation of our work is knowing people. However, we firmly believe that you cannot ask people what they want. Asking people what they want only leads to incremental improvement, not transformational change. Transformational change comes from observation, interpretation, experimenting, and co-creating. The system is big, and it is complicated. And it has its own gravitational pull. What do we mean by gravitational pull? We mean the constraints and realities of the existing system. These are powerful, these are hard to confront, and these take a significant amount of energy to resist. These include reimbursement, existing regulation, physician licensure, the way we train providers, even our own institutional culture. To do our work, we have developed these 4 mindsets that allow us to move forward.
So in healthcare, we have a choice about how we anticipate change. We can choose to be dismissive, we can choose to be resistant, or we can choose to listen to what people are sharing with one another and what they're getting excited about in their everyday lives. And we can use that to inform what direction to take. In 2011, the first Quantified Self conference was held. And that year, Fitbit sold about 200,000 devices. Last year, Fitbit sold 10.9 million devices. All around us, there is a proliferation of devices and sensors that are making it easier for people to collect and analyze their own health data. Whether proven or not, whether we in healthcare recognize it or not, people are making the connection between purchasing these products and their health aspirations. So what place does all of this have here? Do we have systems and workflows that are ready? Are we bringing the right mindset to prevention and wellness? The nurses, providers, exercise specialists, and nutritionists in our cardiovascular health clinic were interested in these questions too. And we invited their patients to track their physical activity and their nutrition for 2 weeks prior to a visit about cardiovascular risk and lifestyle. We also asked them to self-reflect about what they were learning from this experience, and to also describe to us how they felt about their health. This experiment was like injecting contrast dye into the system. It showed us all of the points where current norms were going to clash with this new way of engaging. Looking back, we brought clinic-centered biases to our initial approach. Our first reaction was to take this new information and process it in the same way that we would other medical data like lab results. We were concerned about setting targets, about what if the data was incomplete or inaccurate? What if people misrepresented what they were eating, maybe the donut 2.0, or how much they exercised? What if patients lied? What would that do to our analysis? As we observed the visits and we listened to people, we realized we were missing the point. And perpetuating a system that focuses more on the negative results of people's behaviors rather than the conditions and the situations that drive those behaviors. We thought that the clinic's role was to interpret for people and advise them on the changes that they should be making. But what we found people were already arriving with was this self-awareness. As one person shared with us, this visit was kind of like getting pulled over when you knew you had been speeding. What people were looking for from the care team was how to make these changes in their lives in a sustainable way. And therefore, for the care team, the value wasn't in the self-tracking data alone, but how it could be used along with the patient's self-reflections to better understand the person and connect with their perspective. So we have a choice about how we anticipate this new technology and this new way of engaging. We can force it to fit the shape and the norms of the system we know, or we can use this as an opportunity to reframe and change our shape to better fit what people need.
Recently, we were speaking with a group of academic researchers looking to create a new survey tool to understand patient engagement and activation. Our research at the Center for Innovation, despite the assertions of the clinical community, is that the presence of the unengaged patient is likely a myth. We know that people are working hard every day to engage with health and healthy behaviors, but it's the system that gets in the way or our measurement tools that are unable to pick up on this work. The researchers, though, didn't agree with us, and they offered us a case study to prove that there was an unengaged patient in their system. This was the case of an elderly patient who had recently passed away. And when they were cleaning out his condo, they opened up the top drawer of his dresser, and inside found hundreds of unopened prescription bottles. Our work at the Center for Innovation is really looking to how we can become a partner in people's lives rather than an exclusive authority of healthcare. And so when we reflected back on what the researchers were telling us, we realized that they were blaming the patient, not the system, for this failure. But when you think about it, this patient had been going to his appointments, and he'd even been refilling his prescriptions. So according to their measures, he was engaged. But who knows why he wasn't taking his prescriptions? Maybe he didn't find any value in what they were. Maybe he didn't understand the instructions. Maybe they tasted funny. We don't know any of these things. We don't know these things because of the way that we define engagement and the way we measure it. And in the current system, if you can't measure it, it doesn't exist. We believe strongly that the current work going on in healthcare around engagement and activation is missing the point. And if you think about it, we call it patient engagement, which implies to be engaged, you must be a patient. So we worked to redefine these terms. It's now engagement in health for us, the ability of individuals to pursue healthy behaviors in their daily lives. And activation of healthcare, how people are able to optimally interact with healthcare as a partner in their engagement in health. So if you reframe things, if you change how you define them, you change how you measure them, and that changes your ability to act on the information. So how do we understand and support the engagement that people already have in their lives? We all know that engagement is happening outside of the clinic walls, outside of the exam room that we insist on taking these measurements. Our work now is not about how to get people more engaged, not to get people to do the things that healthcare wants them to do. Instead, we're now trying to anticipate a future where people will be able to easily activate healthcare as a partner in their lives. The point is, if you begin to reframe things and redefine things, you'll discover ways that people want to interact with healthcare that you never understood or anticipated. So as you listen to Rose and I talk about our projects, you might think, the only perspective that the Center for Innovation cares about is the patient. And it's true, we do start with the needs of the patient, but we understand that it's the users throughout the entire system and their needs that matter as well. So you can start and define the problem, you can come up with ideas to fix it, but you have to act to inspire change.
So to act, we obviously need the help of our staff. And our staff is stressed and overburdened. So when we come in with a new idea, something we want them to try, it can be scary. It can feel like we're throwing one more thing on top of a very long list of things they have to do every day. And it's that fear that can stop us from moving forward. So it's important to take the time to understand the concerns and anxiety of our staff in order to break through that fear. And we can't just ask them, because a lot of the times the things people say doesn't accurately reflect the entire picture. So the hospital can feel like the twilight zone. Things that regularly occur there would never fly other places. For example, it's hard to picture another place where you would see someone explaining to an adult woman in tears out of fear that she has to go home because the system won't let her stay for one more night. And our staff knows the situation's not great, but they're used to it. They know how to manage it. In fact, they have to be comfortable with it just to get their job done each day. One physical therapist said to us, if I let all the little things bother me, I would just be stressed out all the time. But the point is that we need our staff to feel comfortable and want to do things as we try to enact change. And we have a couple techniques that we like to use to build excitement and buy-in when we go in and ask this of them. The first is to show what's in it for them. And when I say them, I mean all of our end users. How will this idea benefit the patient? How will it benefit our staff? And how will it benefit the organizational leadership? The second is to make it easy. And I'm not saying that we try to simplify complicated ideas. Instead, we remove the burden from our staff. So a good example is we were recently doing a whiteboard experiment, and one of the residents was very concerned that she wouldn't have time to write the notes the way we had asked her during the short time allotted for rounding. We said, that's fine. If you can't do it, we'll do it for you. We never had to do it for her. There was always enough time. And the last is that we invite them to be a part of our team. We never come in and say, this is a Center for Innovation experiment. We say, this is our experiment, and what works for you and what you want to do is really important to us as we start to move forward. So these are kind of the ways we start by acting small and kind of creating a little bit of space for change. But to create true sustainable change, especially in a big system like Mayo, it takes time and persistence to break through that gravitational pull.
So a new project charter came into the Center for Innovation, and it was to look at our outpatient practice or our specialty practice and reduce costs by 30%. And from our perspective, this charter is missing the point. So why do I say that? We say that because we cannot take our existing system and optimize it or tweak it to have a 30% cost reduction. We need to redesign the system to get that. And then the opportunity becomes, if we're going to redesign the system, The goal should be to meet the needs of people. So with this new goal, we started with design research, and we wanted to understand the challenges that people have with the current system. And we learned a lot. We learned that patients are complex, again. We learned that access is limited. We learned that transitions are often poorly considered, and there's a significant amount of clerical burden for all the providers and staff that work in the clinic. These observations and many others allowed us to start to describe a system that we wanted to create. What behaviors would it have? And we created this system vision as well as these design principles. So our vision was to create an intelligent, adaptable system to provide an unparalleled experience to meet the needs of people. And then underneath we had design principles. Under those design principles, we started to experiment to learn about potential solutions. And at this time and during the experimentation, we learned a lot of really, really interesting things. For example, we learned that the way someone answers a question can be as revealing and useful as what they say. Another example is we learned that if we can tap into the micro availability that each one of us has during the day, we can design a whole new way for the practice to collaborate with one another. And this is where the gravitational pull of the system started to reemerge. People started looking at our ideas and putting a lens to them with the metrics of the current system. For example, we ran an experiment where we had patients who would take weeks to see a specialist. We were able to connect them with that specialist the same day. Instead of celebrating this opening of access and this flexibility within the system, people asked us why we were designing interactions that could not be reimbursed in our current fee-for-service climate. This happened many times. And so the point is, if we're going to persist and fight the gravitational pull of the system, we need to describe a system vision and design principles. So, I know what you're thinking. You're thinking, what can I do? What can I take away from this talk?
You can stay focused on what is important, which is understanding what people need from the system and using that to drive your decisions and the effort you invest. It's going to be really hard to stay true to that focus. It's going to take courage and persistence. The gravitational pull is a daily reality, strongly tied to current measures of performance and success. But you are not alone in facing those constraints. Today at Transform, you are joining a whole community of people who also want to push back, who are looking for ways to bend, if not break through those constraints. So while you're here, find them, learn from them, and take those ideas back home with you.
So if we can convince you of just one thing, it's going to be to ask why a lot more. We want you to question your data, question why people do things the way that they do. And when you go home, we invite you to look for new ways to understand people, to look beyond the patient family advisory councils and the surveys that we typically use to understand our patients, and instead try to understand what matters to people and what motivates them, and use that to drive your ideas for change instead of system pressures. So what we're really asking you is to look for new ways to fight the gravitational pull of the broken system that we live in. And we know it's hard, and that's why we use things like this to try to help focus us. But we know there's a lot of other ways to do that, and we'd love if you'd come talk to us about what you do later. We'll be sitting in the forum. That's it.
Thank you.
Thank you.